An advisory panel recently came out with new recommendations for mammograms. The Fox Medical team's Beth Galvin spoke with a breast cancer surgeon about what the guidelines mean for women.
City of Hope breast surgeon Dr. Anita Johnson says the new U.S. Preventive Services Task Force recommendation that women start getting mammograms at the age of 40 came as a relief for her. Sort of.
Well, finally, we're back to 40. In 2016, we were at 50.
But now the task force is recommending mammograms every other year from the age of 40 to 74.
The American Cancer Society, as well as other societies, still recommend annual screening, and annual screening has been proven to lower the mortality rates.
These screening guidelines are for women at average risk of breast cancer.
If you are any woman and you have a strong family history, particularly of early age onset breast cancer, younger than 45 years old, then you need to talk to your primary care doctor about when you need to start having screening mammography. You definitely need to start having clinical breast exams at a much younger age. Usually it's around 25 years old.
And the American College of Radiology recommends that women in higher risk groups, such as those of Ashkenazi Jewish descent and Black women, get a breast cancer risk assessment by the age of 25 to determine if they need to start breast cancer screening before the age of 40. And Dr. Johnson says women of Ashkenazi descent are more likely to carry the BRCA1 or BRCA2 gene mutation, which can raise their risk. But it's not clear why Black women are at higher risk.
But what we know is that they present at a much younger age. They can present with a more aggressive breast cancer. And then when we look at their survival rates, they are significantly worse than their Caucasian counterparts, with a 40% mortality rate stage for stage.
The bottom line, Dr. Johnson says, do your breast exam and read your mammogram report, because if you have extremely dense breast tissue, she says you may need additional screening, such as a breast MRI.
So all women should know what their mammogram looks like. It's not just doing a breast exam, but knowing if you have dense breast tissue or not. But we encourage women here at City of Hope to have mammograms starting at the age of 40 every year.
For your Fox Medical team, I'm Beth Galvin.